Hello everyone, my name is Karina Meyer and today I'm presenting on the medication trazodone. Trazodone is particularly an antidepressant that is widely used in clinical practice, particularly for patients who experience both depression and also sleep disturbances. In this presentation, I will review how trazodone's pharmacology, pharmacokinetics, indication, dosing, side effect, and important considerations are for patient care. So trazodone is often prescribed in clinical practice, but although it is FDA approved for the treatment of depression, it's also widely used off-label for insomnia. I can relate to this. I take trazodone for sleep disturbances personally. Many providers choose trazodone because of its sedating effects, especially in patients who struggle with sleep problems along with mood symptoms. So research has been shown that trazodone can help improve both sleep quality and symptoms of depression in certain patient populations. Trazodone is classified as a serotonin antagonist and reuptake inhibitor, often abbreviated as SARIs. They work by increasing serotonin levels in the brain while also blocking certain serotonin receptors. So this combined effect helps regulate mood and can contribute to its antidepressant properties. In addition, trazodone has an antihistamine and alpha blocking effect. So these effects are what make trazodone sedating, which is the reason many prescribers give it to patients who have sleep issues, even when depression isn't their number one issue being treated. Trazodone is well absorbed when taken orally. Once the medication is absorbed, the liver metabolizes it primarily through the CYP3A4 enzyme pathway. Because of this metabolic pathway, trazodone can interact with other medications that also affect this same enzyme system. The medication may be taken once or sometimes twice daily, depending on the dose and which treatment it's indicated for. Trazodone has a moderate half-life, meaning it stays in the body for a significant period of time before being cleared. The drug is eliminated through the kidneys by way of urination. So some drug names for this medication. So the generic name for this medication is trazodone. It is most commonly known also under its brand names, which are Desril and Eleptro. While brand name versions exist, the generic form is widely available and it's also the most prescribed in practice, mainly for its cost effectiveness, which we will get into soon. So the dosing for trazodone can vary depending on the condition being treated. So for depression, higher doses are typically required, usually ranging between 150 to 400 milligrams per day in divided doses. However, when trazodone is used for insomnia, like for me, much lower doses are generally prescribed, often between 25 and 100 milligrams at bedtime. The exact dose depends on how the patient responds to the medication and how well they tolerate the potential side effects. So some indications. So as we talked about, trazodone is FDA approved for the treatment of major depressive disorder. However, in clinical practice, it's also used widely off-label for insomnia and sometimes even for anxiety. Many providers prefer trazodone as a sleep aid, and this is due to the fact that it has a lower risk of dependence as compared to other commonly prescribed sleep medications such as Ambien. So some side effects. Some of the most common medications, trazodone can cause side effects. Some of the most common ones are drowsiness, dizziness, and dry mouth. Because of trazodone's alpha blocking effects, it can sometimes cause orthostatic hypotension. I've actually experienced this myself. Because of this, patients may feel dizzy or lightheaded when they go from sitting or squatting or lying down to standing. So even though these are rare side effects, they can cause some serious adverse reactions. So some of the serious adverse reactions are priapism and serotonin syndrome, both of which require medical evaluation promptly. So trazodone should not be used in combination with monoamine oxidase inhibitors, also known as MAO inhibitors, because of the risk of serious drug interactions. This medication should also be cautiously used in patients with certain cardiac conditions due to the potential risk of arrhythmias. In addition, If you combine trazodone with alcohol or other central nervous system depressants, it can cause increased sedation, so patients should be told to avoid these combinations. So, pregnancy considerations. So, there's a limited research on the use of trazodone during pregnancy. Because of this, the medication should really only be used if the possible benefits really outweigh the risk to the fetus. So, this treatment decision should always be made carefully on a case by case basis with you and your provider, and the provider will take into account your overall clinical condition before prescribing trazodone if you are pregnant. So, let's get into cost. One advantage of trazodone is that it's very affordable. The generic form of medication is inexpensive and usually is covered by insurance plans. I think I pay less than $20 out of pocket for a 3-month supply, so it's very cost effective. Trazodone is often considered one of the most cost effective treatment options compared to newer treatment options. So let's look at this patient case study. In this case study, we have a 45-year-old female who presents with insomnia and mild depressive symptoms. She reports difficulty falling asleep and staying asleep, along with low energy and some mood changes. So in a situation like this, trazodone could be a really reasonable treatment option because it may help address both the sleep disturbances as well as the depressive symptoms at the same time. 2 birds, 1 stone. Here's some evidence-based support behind trazodone. So research supports trazodone's effectiveness in improving sleep quality and treating symptoms of depression. Studies have shown that trazodone can help patients fall asleep faster and remain asleep longer. Although trazodone is not technically FDA approved specifically for insomnia, it continues to be widely used for its purposes in clinical practice due to its sedating effects and its relatively low level of dependence. So here's some patient education for trazodone. Patient education is very important to give when prescribing trazodone. Patients should be instructed to take the medication at bedtime because of its sedating effects. Patients on this medication should also be taught to avoid alcohol or other medications that may also increase drowsiness. In addition, patients should be encouraged to stand up slowly from sitting or lying down in order to reduce that orthostatic hypertension or that dizziness and fainting. Any unusual side effects should, of course, be reported immediately to the healthcare provider. So, as nurse practitioners, it's important to evaluate the patient as a whole when prescribing medications. This includes not only reviewing the patient's medical history, but getting a list of their current medications and any possible drug interactions that may occur. Providers must also determine an appropriate starting dose, educate the patients on how to take the medication, and discuss which side effects to watch for. Ongoing monitoring is also important for trazodone so that any adjustments can be made depending on how the patient is responding to the treatment. So for monitoring and follow-up, patients who start trazodone should be observed for changes in both their mood and their sleep patterns. It's important to watch for these side effects as well, particularly during the early stages of treatment when the body's still adjusting to the medication. It's recommended that the patient follow up after a few weeks so the provider can see how the patient's responding and decide whether any adjustments need to be made. And that concludes our presentation today on trazodone. Here is the list of references used, and thank you very much.